Welcome everyone, and today we're diving deep into survey research, one of the most widely used yet often misunderstood research methods. Whether you are studying patient satisfaction, employee engagement, or public attitudes, surveys are a powerful way to collect data at scale. But to get meaningful results, we must carefully design every step of a survey, from framing the research question to using validated instruments, to analyzing and interpreting our findings. By the end of this lecture, you will know how to create surveys that are valid, reliable, ethical, and truly useful. So let's dive into this. So what is survey research? Survey research involves systematically collecting information from individuals using a structured instrument. Most often, this is a questionnaire. The purpose can range from exploring opinions to measuring behaviors, attitudes, or knowledge. And as you remember, we talked about my survey on knowledge and attitudes in Parkinson's disease. So this was one good example of how we can use a questionnaire in a survey. Then, for instance, you may use a survey to assess treatment satisfaction among patients or to explore public attitudes towards vaccination. This is another thing we discussed when I had the vaccination topic with statistics. Surveys can be cross-sectional, meaning that they capture a snapshot in time where you will just make the participants participate in the survey at a certain day and time, and they record their responses then. Or it can also be longitudinal, which follows changes over time. And they can be fully quantitative, qualitative, with open text responses, or mixed. And the key is that they rely on self-reporting, which comes with both strengths and challenges. So why do researchers like surveys and why do we use surveys? Firstly, they are very cost effective, especially for large groups. So you don't need to waste a lot of money on any materials, especially if you're distributing it online. And neither do you have to interview people personally and waste your own time. And they provide standardized data. So everybody answers the same questions in the same way, which makes analysis very straightforward. This is different than, for example, a qualitative study where you're interviewing somebody and you're asking them open questions and they will be answering them in very different ways. So there's no the standardized data. On the other hand, this is why surveys are good because we're asking the same questions and people will have to pick the answers from a certain scale or from a certain choice of answers, and they are standardized. And surveys are also flexible, so we can administer them online, on paper, or even in interviews. And importantly, surveys often give us the only feasible way to measure subjective experiences like quality of life, job satisfaction, or patient preferences. And these are only a few examples. You can use surveys for practically any area of research. And we, of course, have several steps in survey research. So it isn't just about writing a few questions. It is actually a multi-step process. And first, you must clarify what you want to know. So this will guide everything, coming up with your research question, and then you define your population and sampling approach, which will be based on the research question. So what exactly do you want to study? And next, you will either choose an existing validated instrument, which would be ideal in most cases, or if there is no such instrument available, if you're studying something so unique or so specific, then you might design your own. But this has to be really considered and done carefully. And we will talk about this further as well. And after all of that, you will pilot test your survey, hopefully in a smaller group of people. You might just have a few, for example, patients or any other participants that you will send it to. Sometimes it's just a group up to 10 people who will first respond to all the questions. And if they run into any issues, they will tell those issues to you and you'll be able to fix them before you submit them to thousands of people. Then, of course, you have the data collection in already the large group after the pilot testing, data cleaning, and finally your statistical analysis and interpretation of your findings. Skipping any of these steps actually risks undermining your results, and you might not be able to publish your work. So defining research objectives, you must start with a clear and specific goal. So are you trying to assess satisfaction, knowledge, attitudes, or anything else for your research. And an example here is if my aim was to measure knowledge of Parkinson's disease among caregivers, then my survey should focus narrowly on that. And I wouldn't go into also assessing the quality of life of the patients themselves, because that is already a completely different scope. And you must also consider whether you are exploring a topic, so exploratory study, or you're actually testing a hypothesis, which will be a confirmatory study. And this distinction influences everything from your sample size to the type of questions you will ask and answer. And as I already said, whenever possible, it is good to use a validated instrument. And validated instruments are tools that have been tested for reliability and validity, meaning they consistently measure what they claim to measure. You might have heard already in research, especially in healthcare, that there are certain instruments and they are often abbreviated. For example, PHQ-9 is widely used for screening depression, and the SF-36 is used for assessing health-related quality of life, the same as PDQ-39. And if you are studying, for example, shared decision making, then you would use a tool called SDMQ-9, and this is for patients, and SDMQ-Doc is for healthcare providers. So as you see, there are many of these instruments, and like I said, for every research area, there will be different instruments, and you should first look for such, and probably decide which one you will use to answer your research questions, but validated instruments are really important. And you must also check whether the instrument has been validated for your specific population and for language. So a lot of these instruments, for example, quality of life, you can apply them to any condition or disease. But for example, you might have a specific instrument that is only for a specific condition. For example, vaccine satisfaction is obviously only used in vaccine research. So you must be validating in the specific field. And language is also very important because a lot of those validated instruments are now available in multiple languages, especially in the most popular like English, Spanish, Chinese. And if you want to translate it into your language that maybe the instrument is not officially translated in, then you must do it in like a good, let's say, ethical and valid way. So either you're going to use actual translation services that are certified, or you must talk to your supervisor about how you could maybe use some AI tools to do it. I personally translated a knowledge, attitude, and practice survey for my knowledge study on Parkinson's. I translated it to both German and my native language, Latvian, and the survey was originally in English. And I was guided by my supervisor that I'm allowed to translate it myself because I'm a native speaker in Latvian and I have a C1 certificate in German. But this is something that you must discuss in advance, and you must also then be fluent in English so that you are actually translating it correctly. And then, of course, I also used AI just to check how I have translated my questionnaire. And using a validated tool not only strengthens your study, but it allows for comparisons across research. So in your discussion section, as we also discussed in previous lectures, when we are interpreting results, you come back to existing literature. And oftentimes you're going to look at studies that have, even if it's not in your field. So for example, in my case, that would be Parkinson's. If it hasn't been studied in Parkinson's, I will look if it's been studied in other conditions, for example, Alzheimer's or even cancer. And I will be able to make comparisons between my research and, let's say, the cancer research because we use the same instrument. So we have the same scale and we have results that we can actually compare because they come from the same source. And if you're designing your own questionnaire, that should happen only if there's no validated instrument for your specific topic. And also, let's say if you have a validated instrument, but it's not really addressing what you want, you should first try to adapt the validated instrument. So meaning you only change maybe a few questions or you specify certain things, but designing a questionnaire completely from scratch should only be done if there's actually no validated instrument to measure what you're specifically studying. So I am currently conducting a study in my home country, Latvia, on regional disparities in access to Parkinson's disease care. And there was no validated instrument for such because I'm especially doing it country specific to Latvia. So I had to develop and design my own questionnaire. And in this case, it's important that you have a support group or a team who will work on a questionnaire with you. Also check the questions because sometimes you might not notice things that you've put in there that maybe don't make sense or they're misworded or you're maybe asking two things in one question. So this is why it's important to have other people double check it and triple and quadruple check it. And it's important to use clear, unambiguous language, avoid jargon or culturally loaded terms. And never combine two questions in one. Again, something I mentioned that maybe somebody can also check that for you. For example, you would never ask, do you find telemedicine affordable and convenient? Because then you cannot get proper response for quantitative data. So you must ask then two questions. Do you find telemedicine affordable? And then do you find telemedicine convenient? And you should keep your response options balanced. For example, in a Likert scale, a Likert scale is, you will often see surveys that ask to rate something from 1 to 10 or from strongly disagree to strongly agree. And everything in that scale, it's a Likert scale. And when you collect your data, then you can afterwards turn it into a number data. So if you have from strongly disagree to strongly agree, let's say it's a 6-point Likert scale, then you're going to number it 1 through 6. And in that way, you're going to analyze your data in statistical software. And you, of course, have also sometimes mixed, let's say, closed-ended questions, which are easy to analyze, like I said now. So we have a scale that we can quantify, or we're asking demographics, which would be certain ethnicities, and you can quantify them afterwards as well and code them with a number. And sometimes you will also have open-ended questions, which will capture richer insights. And that's qualitative data. So you might be only able to mention it in your, let's say, paper or research manuscript afterwards. And like maybe collectively see if there were multiple people who answered in the same area, like similar way, these open-ended questions. And you can mention them as descriptive data, but you cannot turn it into numbers. And yeah, so this is already what I just touched on. So we have these closed-ended questions, which make analysis easier. So we have the Likert scales, multiple choice or rankings. And we will have the open-ended questions, which give participants space to elaborate, which is very valuable for exploratory studies. And you should never forget demographics. So almost every survey is going to collect the participant demographics, such as ethnicity, age, gender, region of residence, income level, maybe a marital status. So these are all crucial for understanding your sample, and you will be able to perform subgroup analyses. And oftentimes, a secondary purpose of your study will be to see if these demographic variables, let's say, predict whatever you are studying in this research study. So I also just conducted a study on shared decision making in Parkinson's disease between patients and their doctors. And I specifically looked if their sociodemographic variables predict their involvement in shared decision making. And I found some really interesting insights. So education level, age, employment status, those are all often predictors, especially in health research. So this is why it's very important to not forget the demographics. And of course, sampling is critical. In probability sampling, every person in your population has a chance of being selected. So you think random or stratified sampling. And non-probability sampling, like convenience or snowball sampling, is easier, but it may limit generalizability. So you must always balance representativeness with feasibility. And you have to be realistic about response rates. So online surveys often achieve only 20 to 40%. So you must oversample accordingly. You might get power analysis. This is also something we spoke about when I taught you statistics. There's this nice software called GPower. And you can use that to identify what the power, so the sample size of your study must be according to the statistical tests you want to afterwards run. And it might be 100 or 120 participants, maybe even less sometimes. But to get to that participant number is often really complicated. So on my shared decision-making study, I had to have 60 patients and 60 providers, which is 120 together. And I thought this is going to be very easy to get, but it was actually quite hard. So I had to email over 2,000 patient support groups and repeat my emails multiple times. And I emailed about 6,000 providers in order to only get about 80 of them to respond. So, especially in healthcare research, from all my own experience, I can say that doctors and other providers like nurses are really busy in their jobs. So, they often don't have time to fill out surveys, even though they would think that it is valuable. But that doesn't mean that you have to give up. You just have to keep trying and you have to send reminder emails and also be polite in your emails so they don't think that you're just spamming them, but they like actually present how important your research is and why they should be participating in your survey and research. And I also mentioned already piloting your survey. So you should never launch a survey without a small pilot test. So you would ask a small group from your target population to complete it and provide you with any feedback. I did that with my study in Latvia as well. I asked a few patients that I had direct contact with. I sent the survey link only to them in the beginning. They went through the survey. I asked them if they were able to go through it smoothly, if they could answer all the questions, if everything made sense, if they were able to see the submit button in the end and actually submit the results. I have heard some stories of researchers who put their survey out and they're not getting responses and they're not sure why. And it turns out that people are just filling out the survey, but they're not clicking that, for example, on Google Forms, sometimes you need to click submit twice. So this is something that you also must then write into instructions for participants because not everybody is used to a certain platform for surveys and questionnaires. So you must be careful with that and yeah, test it first so you don't send it out to thousands of people and don't get any responses, even though the people filled it out, but it just didn't get recorded, for example. And it's also very important to just ask these pilot testing people, were there any confusing questions? Yeah, did the online platform work smoothly? And how long did it take them? In the very beginning of the survey, where your consent form is, you should always put in the time, approximate time that it will take for a participant to complete the survey in normal circumstances. Of course, somebody might leave the survey open for like a day and it will record them having done it for a day. But meaning that if somebody sits down and does the whole survey, how long did it take them on average? And you can also then change that in the time after your pilot testing. So if you assumed it would take people 10 minutes, but it's taking them 20, then you can still change that in your consent form and people will be able to read that and decide if they have the time to participate in your survey before they do. And this pilot testing will often save you from big headaches later as dealing with problems when the survey is already distributed to thousands of participants or posted somewhere on social media where anybody globally can access it and start it. And further about data collection methods. So you can collect survey data online. This is what I've done most of the time. So there are certain platforms like Qualtrics. I didn't know of this until I started doing my PhD. Qualtrics is really nice. Some universities have a license for it, so it's even better because you can do an unlimited number of questions and unlimited number of responses. There's, of course, Google Forms that I think most of us have heard of. There are a lot of surveys out there that you can fill out and they're on Google Forms. And there's also a thing called RedCap, which I have not yet used, but I hear good things about it as well. And these are all excellent tools for research. Paper surveys are still useful, especially in clinics or low technology settings. I know from experience with my knowledge study for Parkinson's that I originally thought I was only going to distribute the online survey, but I ended up having to distribute some paper surveys because there were just patients who were not able to use technology. And maybe it was because of their condition, because of their hand tremors. This is very common for Parkinson's patients, but it also could have been because they are older population and they don't know how to use technology. So these are things you might consider if you are going to study some, I don't know, disease or any other thing in an older population. You might immediately consider also providing paper surveys. And in my case, I was able to actually do it pretty nicely because I didn't have to travel to the sites to distribute paper surveys. I emailed, for example, a director of a support group or a clinic, and they printed out the surveys and distributed them to the patients. Then the patients filled them out, and the person scanned them and sent them to me by email. And then actually I was able to fill in the data into the online platform. So it's all in one place. And when I downloaded the data, it was nicely in the Excel sheet all together without, me needing to look separately at the paper surveys and online. So I just put the data all together. And there are also interviewer-administered surveys, which can boost some response rates if you're not getting enough paper or online surveys filled out. And they also can clarify misunderstandings. If a person sees a question in an online survey, they might just answer it how they think in that moment, or if they don't understand it, they might just click a random answer. But in an interview setting, they might actually ask, so what do you mean by this question? Can you give me an example or can you explain? And of course, these interviewer administered surveys are more resource intensive. So you actually need to be there. It involves your time and probably also costs of traveling and other things, and maybe even employing other people to help you do the interviews. And sometimes a mixed mode approach works best. So you can choose either to do all three or two of those, like I did for my survey. I can really suggest doing online and paper and maybe picking on some interview administered surveys in case your response rates are really not growing at any point of the recruitment. And then it's important also to consider ethics in survey research. Again, something I've mentioned in some of my previous lectures. Ethical approval for any study on human subjects is needed. It might seem to us that it's only needed if you're testing something on humans, such as, for example, a clinical trial that is testing a drug. But this is actually not true. So surveys may seem harmless, but they still require ethical oversight. We need to make sure that you're not asking some inappropriate questions or asking, questions that may harm the person emotionally or even physically in some ways. So participants must always provide informed consent. They need to know why you're collecting data and how it will be used at the end of the day. So you must decide whether responses will be anonymous or just confidential. Anonymous is when you have no idea who responded to the survey. You're not collecting their names, their birth dates, not even their IP address. You might not even know where in the world they are unless you're asking for their place of residence. Or they may just be confidential, meaning you still collect all the information, you collect their names, birth dates, maybe even contact information, but you just keep it confidential. So you're not going to publish that information, but you may use it for your own purposes within your research team. And you must always keep participant burden low. So if your survey is too long, you risk dropout. And like I said, you must get this ethics approval or IRB approval. IRB stands for Institutional Review Board. For all my survey research, I have gone to my universities, University of Jamestown, IRB, and they've granted me approval. And I have actually had a really good experience with the IRB process because the IRB consists of a board of people, some of whom may have no idea or no knowledge of the topic that you are studying, but that makes it unique because they're looking at it just from the view of like safeguarding the participants. And they might find things that you haven't noticed in your research. So you might be providing like recruitment materials, some emails or posters, and there might be some language in there that is forcing the participants to participate, even though your study is supposed to be voluntary and with informed consent. So these are things that the IRB board will catch and make you change. And also they might just see other things. Like I recently submitted an IRB application for a study on education settings, and I wanted to use a validated instrument that I found online, and I hadn't seen that this instrument requires copyright permission. And the IRB board caught that and sent me an email and asked me if I have the copyright permission. And I said that I will now get it because I did not notice that on the website. So it's it's a win-win in a way because you have extra eyes on your research idea and they can help you in those ways as well. So to make sure that you're doing everything correctly and maybe even refine some of your research questions if something is unclear. So this is a step that you for sure should not be skipping. So before you start any participant recruitment, before you reach out to anybody about the study to participate, you must have an ethics approval. And of course, we need to ensure that our survey is valid and reliable because that's how a good survey will be. We have content validity, which means that your questions cover all important areas of what you want to measure. For example, a patient satisfaction survey should include questions about communication, access, and care quality, and not just, let's say, waiting time. So it has to look at the overall patient satisfaction, not just one factor, which in some cases would be waiting time, but we also have to see the communication process between the patients and, let's say, the providers, their access to care, and of course, also the quality of care. Then we have construct validity, which checks if your items really measure the concept that you are interested in. For instance, if you're measuring depression, you will use a tool like PHQ-9, and that makes sense because it is based on established criteria for measuring depression. You also have reliability, which means actually consistency. So if someone answers today and tomorrow, their results should be similar. And we often can check this with Cronbach's alpha for multi-item scales, and there will be a 0.7 or higher, usually meaning acceptable. And again, the pilot testing of your survey. So you're going to try it with a small group first, and this will help catch confusing questions, assess reliability before any large-scale use, and especially if you developed the survey yourself and did not use a pre-existing validated instrument. And once your data collection is complete, you must start with descriptive statistics. So you will look at what is the average score if you're looking at some Likert scale or scored items. Then how many respondents chose each option. You will often present that also with the number of participants, and in parentheses, you will write the percentage. So if you're publishing the research, the audience can easier understand then how many, what percentage of participants chose which option. And then you're going to move into inferential analysis. So if you are comparing groups like I did with the patients and providers, you will use t-tests. Or if you're going to predict outcomes, then you will use regression. So if you want to see if, let's say, sociodemographic variables predict involvement in shared decision-making among patients and providers, you will use regression for that. And you might even use multiple regression if you want to see if a combined, let's say, the sociodemographic variables and health literacy together predict the involvement in shared decision making, then you will be using even multiple regression. And if you have the open-ended responses, which are qualitative, then you can thematically code them for qualitative insights. And you also shouldn't ignore any missing data. You should decide upfront how you will handle it. So there are different ways. There are different research papers on you can estimate missing data. You can just drop responses that are not complete. There are just different multiple ways also in statistical analysis. So it depends on what exactly you're asking. But this is something you can research from other research papers that have studied maybe similar areas or similar topics, and you can just do some research on that as well. And common pitfalls. So overall, they would include poorly worded or leading questions. So, for example, you shouldn't be asking things like, how much do you enjoy telemedicine? Because this presumes enjoyment, but you really would be studying what is the patient's satisfaction with telemedicine. They're not really enjoying it because maybe they wouldn't be involved in telemedicine in the first place if they were not sick. So you have to avoid such questions, especially when you're developing your own survey. And as already mentioned, surveys that are too long can cause fatigue and incomplete responses, which then may be bad because of the missing data. And not testing for reliability or failing to adapt to cultural context can ruin your findings. And again, this is why we want to use validated instruments and also collect the demographics. So we can collect data from a very general population and from all over the world, or from certain regions, then actually look at people from different ethnicities, from different age groups, and not just have everybody from one age group or from one ethnic group. And you always keep your participants' experience in mind. If you see that there are people sending you emails saying the survey was really hard to complete, it was really confusing, then you should consider what you did wrong. If it's too late to change that for that current survey, then you should definitely change it for the next one and take that feedback into account. Because a lot of times, if you are really interested in one area of research, like I am in Parkinson's disease, you'll be coming to the same participants again the next time when you conduct a survey. So yeah, I did the knowledge study in Parkinson's, and I emailed the same support groups also for my shared decision making study. So this is important that you have these contacts and that people are satisfied with completing your research studies, and not just giving you bad feedback and then choosing not to participate the next time. And some key takeaways. So in summary, you should begin with a clear goal with a research question. Use validated tools when it's possible. Always pilot test your survey. Of course, secure ethical approval, and plan for your analysis before you start. That always includes making maybe some little outline. I personally am a really big paper person. I write down on paper which statistical tests I plan to use. I maybe sometimes like draw, like brainstorm around, and this is really helpful. So you should do what works for you, as long as you get there in the end and you're satisfied with your own study and your results. And surveys are powerful only when they're done well, and misleading when they're done poorly. So that's something that you should always keep at the back of your head when you're designing a survey study. And yeah, thank you for joining my lecture today. It's nice to see the same faces every time I give a lecture here at AIU. And I will now give the room to you to ask questions. And if we do not get through everything, then you can always email me to the email address on this slide. And I already want to thank those who have done so. And I've provided you guys with some feedback on your work as well. And I'm really excited to see where some of your research is going. So yeah, thank you. And yeah, it's time for you to ask questions.
Thank you, Paula. As she said, if you have any question, please use the hand reaction or leave a comment in the chat. So we have for now one question. So let's see what Ismail has to say.
Good morning, everyone. Yeah, good morning, the presenter. Thank you.
Hi.
Yeah, hi. Thank you for the presentation. Yeah, my question is this. Before the question, I want to mention something from the presentation. When you mention common pitfall, I'm sorry, my child really making noise, I'm sorry. Yeah, when you mention common pitfalls, now you mention about ignoring cultural context and others, which is a non-testing, reliability and validity, poorly worded, or leading questions, and so forth. Now, the question is on cultural differences. So let me ask the question. How can cultural differences impact survey responses, and what measures can be taken to design culturally sensitive surveys?
Yes, thank you for your question. So this is something that a lot of us do not consider when we're doing surveys, but it should be considered that, especially if you're conducting a survey over several regions, maybe even several countries. I can give an example from healthcare research. Their healthcare systems are different everywhere, so it will be different in the United States than it is here where I live in Germany versus, for example, Africa, or even different countries like, let's say, Thailand. So that's one thing to consider, that people will be giving their responses based on where they are and what are their cultural experiences with their healthcare systems. And this is why using a validated instrument is better, because the questions are not specific to one country system. They are like overall. So if you are answering how satisfied you are with your treatment and you live in, let's say, the United States, versus I'm answering how satisfied I'm here in Germany, then I'm just putting a scale out of 10. I will say I'm satisfied a 6, but you will be satisfied a 9. And then when we're looking at the data analysis, we will see that those people who live in a certain region, let's say in the United States, they are saying they're more satisfied with their treatment, and we can make then conclusions that maybe their healthcare system is better, for example. So this is one way that you can ensure that you're, taking into consideration this cultural context, that you are asking more vague questions and you're not relying on specifics. So if you're going to ask a question in healthcare research, like let's say how many no, that's not a good example. Very specific question about a certain medication, let's say, and then it turns out that medication is not even available in your healthcare system in, let's say, Europe, whereas it will be available in the United States, then of course you're not going to include at all the population. So then you will be not culturally inclusive. Does that make sense?
Yes, I got it.
Perfect.
Yeah. Thank you.
Let's go with Abdulaziz.